Good morning. I'm Lauren Meffin, speech language pathologist, lymphedema therapist, owner and operator of Wildflower Therapy. We are continuing our journey for head and neck lymphedema management. Head and neck lymphedema can be a side effect following radiation treatment of head and neck cancer. It can oftentimes be extremely debilitating, very frustrating. And one of the things that we know we can do to help it is to move our muscles, okay? So when you move your muscles, you improve the lymphatic pump and the flow of the lymphatic fluid, which means your swelling goes down. When your swelling goes down, your function and ability to speak and swallow go up, okay? So today, we are going to focus on a very specific exercise. It's one that can help with the swallowing muscles here in the throat. This might be utilized in a patient who's had a base of tongue cancer or tonsillar cancer. These can often help also with neck dissections or lymph node removals in the neck. But first, you know me, let's start with 5 deep breaths. Last one. I like my hands on the belly because I like to be able to see the rise and the fall, okay? Now, this exercise is very specific and sort of tricky if there is no saliva or moisture in the mouth, which is a common thing following treatment. So I'm gonna take a sip just to start off to moisten my mouth. The way the exercise goes is I'm going to swallow, and when I swallow, I'm going to keep my Adam's apple up, okay? I'm going to try to keep my Adam's apple up for 2 seconds. That's very hard. But when I tighten these muscles right here, there's a pulling effect that's going to help with opening my esophagus. So as one group of muscle comes up, the esophagus is going to work to open, all right? Now, first things first, I swallow, squeeze my muscles at the height in the middle of my swallow, keeping that Adam's apple up, and I let it drop. So I swallow, drop. All right, so I'm gonna swallow again. I'm going to count to 2 with those muscles squeezed, trying to keep that Adam's apple up, and then I'm gonna let it drop. So I swallow, drop. Now, I will use my fingers on my Adam's apple just to feel the movement, but I'm not pushing, I'm not pulling, I'm not doing anything to try to get those muscles to go. So I need another sip because my mouth is dry. I'm ready for my exercise. I don't do the exercise with liquids in the mouth. Swallow, drop. We're gonna do 2 more. Swallow, drop. 1 more. I'm out of saliva. Here I go. I swallow and let it drop. So that exercise is going to help with movement of liquids and food through the pharynx or the throat and down into the esophagus, okay? When you make your muscles work and pull things forward, the esophagus has an effect that opens. Download your guide below to follow along. I hope you have a great rest of your day.